Hello, everyone. Welcome to HealthTech with Purpose podcast. And my guest today is Vicenc Ferrer, Managing Director of Mediktor, a company that has been doing great things in healthcare, especially around patient engagement and patient experience. So, Vicenc, welcome to the podcast, and would love to know more about Mediktor right away, and also a bit of your background.
Absolutely. Thank you so much for having us, Ayush. It's a pleasure to be here.
Pleasure is all ours. So, Vicens, why not you start by providing a bit of background about Medicare, what it stands for, what is the problem Medicare is solving today, and let's go from there.
Sure, absolutely. So, Mediktor is a global Spanish company headquartered in Barcelona. We have an office here in New York City as well, and we are present in over 30 countries worldwide, and we cover 50 million lives. We have partnered with top companies worldwide, including health plans such as AXA, Munich Re, Bupa/Sanitas, Mafre, and here in the States with hospitals and health systems like Albany Med, Hope Health, Kaiser Permanente, etc. Right? So you may be wondering why all these awesome and leading companies decide to collaborate and do business with us. So I would say
Yeah,
that the main reason is because we address a problem, an issue in the healthcare industry, which is patient access. Basically, the right patient, the right time, and the right care. So typically, healthcare organizations have been tackling this problem by hiring staff, clinical staff, non-clinical staff, etc. But nowadays, we are in a process that it's been for years now, which is staff shortage in the industry. So there is no way, no option for those healthcare organizations to keep pushing in the same direction. And this is where our all in one platform, empathy driven AI based medical assistant can give them a helping hand. We basically empower patients by offering them on demand, personalized healthcare guidance at the first onset of symptoms. And at
mhm.
the same time, we enable healthcare players such as hospitals, health systems, health plans to direct those patients to the appropriate level of care on a safe, convenient, and cost effective way, anytime and anywhere. So, this is basically in a nutshell what we are, who we are, and what we do.
Great, great. And I believe it's easier said than done, of course, because, looking at many startup stories in my own journey as
Correct.
well, it takes a lot of grit to be able to figure out, eventually what your product market fit is. So tell us more about the early years of Medicare and, where it all started and like you said, it's a Spanish global company. So
Mhm.
I imagine you must have been solving something else at the start, and this whole thing evolved as you kind of met your customers, you figured out, what they really want and so on. So tell us more about that part of your story.
Yeah, no, absolutely. I mean, obviously, I'm gonna focus on the American market, which is what I know, what I've been coordinating, and the early years, and we have to go back to over 6 years ago. They were very, very challenging.
Mhm.
At the time, Mediktor already had a footprint among health plans in Europe, and to be honest, very successful footprint dealing with the largest health plans in Europe. And I was the first hire, and obviously here in the States, and obviously what came to our mind as a team was, well, if this works for health plans, let's do the
Right.
same. Let's approach American health plans and do the magic, right? So it was totally the opposite what happened. The first year was very challenging. We ended the first year with zero sales, which
Oh,
was very, very frustrating because over the paper, it made total sense. We had a strong value proposition around ED deflection for
Mm-hmm.
for health plans, basically generating huge savings for those health plans, making sure that only those members that needed to go to the emergency department, they got there. The rest of the members, which was most of the part, could receive the same quality care at a lower cost through telemedicine, asynchronous care, PCP, etc. You
Mm-hmm.
name it, right? So
Right.
the value proposition was there. So that uh, it was very challenging and frustrating to face that situation where we saw no traction there. And I think that one of the challenges we faced was that here in the States at the time, because this has changed over years, but 6 years ago, there was little to no appetite from American health plans to generate efficiencies around ED deflection. And on top of that, there was a local player in our space that had support from a large health plan that invested a big stake on them and introduced them to other health plans that was basically covering that space. Little we
Mm-hmm.
knew at the time that this competitor not only took those clients but also was kind of poisoning the space because
Right.
they were not delivering upon the value proposition they promised. So
Right.
even if there were like we were not competing with them, chasing new leads or trying to get leads that decided to stop working with them, the whole thing was poison. Nobody wanted to talk about and discuss our solution because of this company, basically didn't deliver upon promised. The most important piece, I believe, is that since Mediktor is a truly capital efficient company, we got the chance after the first year and the time to pivot. Uh,
Mm-hmm.
it's true that we focused our efforts toward health plans, but at the same time, we also kept an eye on other players, mainly hospitals and health systems. And this was a safe rack for us, to be honest. Now, turning back and looking what happened.
Great, great. I mean, it must have been a great feeling now, right? Looking back,
Yes.
so when we come so far, it's like, what does not breaks you makes you stronger. So I
Correct.
think you would have this,
Absolutely.
great advice that must have all accumulated now, over the years.
Yep.
Doing it firsthand, building the whole market. Great.
Exactly.
So, like maybe can you elaborate more about that strategy part that you just said? Like, that 1 year that you go repositioned your strategy to start selling to providers and hospitals. So, can you elaborate a bit more? In fact, one thing I liked is, Vicenc, you mentioned about some of the large names today, like Kaiser and Banimad, etc. So how were you able to get such partnerships and what were some lessons there?
Yeah, absolutely. So it's been a long road, bumpy road, I would say. First of all, as you can imagine, when we realized we needed to pivot, we had to adjust the value proposition, the message,
Mm.
the collateral, marketing material, etc. All of a sudden, we were not a ED deflection tool, but a solution that would allow hospitals and health systems to identify qualified patients and direct them to their care venues, right? So it's the same technology, but it's like the other side of the coin. Working for hospitals here in the States in a hyper localized industry where they compete among each other, where fee for service is still the preferred formula under which those hospitals operate, being able to track patients to their facility is very important. So, as mentioned, we always kept an eye with hospitals, health systems. Basically, we saw their predisposition to do business with us first at events, conferences, discussing with associations whose members were hospitals and health systems. And here I'd like to point out two that I think that help us a lot to find our way in this space. The first one is Node Health. It's a well-known association located here in the Northeast Coast in the States, whose main goal is around clinical validation and digital health solutions like ours. So their mantra is basically look the same way medtech devices, new drugs, they have to go through a process of validation. Digital health companies should do the same.
Mhm.
And that's something that,
What is it called? Can you repeat the name?
yeah, absolutely. Node Health. Um,
Okay.
and this has been part of our DNA since our inception. One of the co-founders of the company, Dr. Garcia Esquirol, was very clear. This is not a toy. This is not a game. We want to put on the hands of patients something that truly works and it's validated. So
Mhm.
they had already done some clinical studies, and we present one of those clinical studies to the Node Health Awards, and we won the award.
Nice.
And
Nice.
as you can imagine, that was very impactful. There was a lot of promotion
It's
of
the
this
credibility.
award here in the States. Uh, the hospitals, health systems members of Node Health were the first one to say, wow, this is very interesting. And actually, one of the first hospitals we start working with, Yale New Haven Health System, is part of that association. So you can see the line thread, right? So that was one. The other one was Avia Health, which is based out of Chicago and whose members, again, are hospitals and health systems. They did 5 years ago a cohort of AI based care navigation assistants, and they
Mhm.
analyzed 40 of them, 40 worldwide. They invited everybody they could find out there in internet. Obviously, they invited us. And after a thorough process of due diligence, meetings, etc., they shortlisted four of
Mhm.
those. And Mediktor was one of them. It's worth mentioning we were the only non-American company to be invited to present before the member hospitals and health systems. And that again generate a lot of awareness around our solution, trust, etc. Right? So I would say that in a nutshell, this is how we reposition. Um, the rest is history, right? So now we are working with companies like Albany Med, Bluestem Health, Hope Health,
Mhm.
Kaiser Permanente, one of the largest dual systems here in the
Right.
States. And maybe we can do a deep dive on Almanimed just to
Mhm.
provide you and the rest of the audience a little bit more about this project and how it helped us reposition
Mhm.
ourselves. And actually, Albanimed is a project that is very close to my heart. And I think that it's paradigmatic of that reposition, right? It was the first like true project that we deployed here in the States. It's true that before we did some business with Austin Renal Clinic during COVID. Before COVID, as mentioned, we worked with Yale New Haven Health System, but Albany Med was the first one that we sat down with them and we said,
Great.
this is what we can do for you guys. They bought it, they have implemented it,
Mhm.
and we are still doing business together, right? And on top of that, this
Right.
project got the attention from Gartner and
Mhm.
basically did a report on our project with Albany Med.
Okay. Nice.
So uh, this project is basically about driving business to this hospital, right?
Right.
So I want you to picture for a moment a patient that is out there, upstate New York, because Albany Med is a health system located upstate New York, is Googling symptoms because he's feeling under the weather. And after this research, information about Albany Med, as well as St. Peter's hospitals and other smaller regional hospitals are going to pop up. And based on this research, this patient is going to decide to go to one or the other one, right?
Mhm.
So what Albany Med did was very clever, which was basically integrated our solution in their website, in their app in
Mhm.
condition-specific landing pages and did very intelligent Google ad campaigns to put the Albany Met information in front of the right people at the right time.
Got
So
it.
that person
Like
that goes
microsite.
exactly,
Hmm.
exactly. Microsites in this case focus on, for instance, pulmonary conditions, because
Hmm.
we know that is very seasonal, right? In winter, you have everything that has to do with common cold, with flu, with COVID, and then in the spring you have allergies, right? So they created this educational content that patients would access, and they would be prompted to complete the care navigation assistant, right? The intelligent intake. And from there, this is how we identify that patient, how we
Hmm.
qualify that patient, and then how we direct it to the appropriate level of care, avoiding wait times and unnecessary steps. And I think that that's basically our value proposition as a whole for one of the value propositions we have for hospitals and health systems, and the one that we have been pushing around ever since.
Great, great. Oh, fantastic. I mean, I'm learning every minute. So, another follow-up question that comes to my mind is, like you said, in your journey, the first part was like how you worked with Node Health and, you were able to do certain clinical study about the effectiveness of the solution. So,
Correct.
what KPIs primarily your customers saw after implementing Mediktor? So, was it more on the revenue side or was it more on patient experience? So, how you measured, how you presented?
Absolutely. It's all about KPIs, right? And I think that we can take the same example of Albanimed because we have some interesting KPIs. In this case, as you can imagine, it's a combination of revenue and patient experience. The
Mhm.
KPIs we have regarding revenue is an 3 times ROI. So if you compare the investment that Albanimed is doing in our solution against the income that is generating through our channel, we are basically paying ourselves and generating 3 times return. And that's
Great.
kind of very impressive. It's true that for health plans, where our business model is more about ED deflection efficiency, we have higher ROIs that go between 6 and 10 times the ROI.
Hmm.
Then, when it comes to the patient experience in Albany we are seeing a net promoter score around 72, which is
Hmm.
an average of 3 times the industry.
Okay.
And this is steady over time. And when it comes to net promoter score, anything that's beyond 70 is considered excellent, which means that basically family and friends are recommending, uh, you know,
Great.
use this solution because it's worth using. And there is another one that is very important for us, which is the user retention, which is around
Mhm.
40%, meaning that 4 out of 10 people is using Medictor recurrently, which means that they are happy, they feel empowered, augmented with our solution, and this is the reason why we are here, right? So that make us very happy. So that's a little bit some of the KPIs we track for this project.
Great, great. So, moving forward, what I would like to know, Vicenc, is, again, piggybacking further on this topic, like selling to hospitals and providers, it is well known for the long sales cycle, and
Yep.
you already shared some aspects
Yep.
around building trust, with the certification or with the credibility that you received. What are other, say, strategies, unconventional or conventional, that you have seen working and even not working? Happy to hear some of
Yep.
the failures.
So, well, there is no way around trust and personal relationships and long sales cycles. That's the truth. Okay.
Right.
So, especially when you are talking about introducing innovation
How
in the
how to
market.
remain patient, then that is the problem. How to remain
Yeah.
patient for so long.
Yeah, you have to be very patient. You have to be on the spot. But what I wanted to say is that there is no way around it, especially when it comes to innovation, right? These people, these organizations, they would like to see you just around, not truly engaging with you at least for a year, because
Mm,
countless times they have decided to invest in an innovative company, and this company for any reason basically disappeared. So that's a protective way they have to make sure that the companies they engage with, they have gone through this kind of process
mm,
in the market, right? So there is no way around it, but there are strategies how to basically cope with this situation. I would say that one that is very important is making sure that you have a balanced pipeline that
mm,
combines big projects, usually for large hospitals, health systems, tier one, that are going to consume a lot of time and resources because you have to meet with multiple people, multiple departments, and the whole process take forever. That's one thing. Combine them with other smaller projects for regional tier two, tier three hospitals, where you may have the ability to engage with the C-level executive, the C-suite, and the whole process is going to take longer. So just make sure that you
right.
have that balance. That's very important.
Mm,
Then you have to be prepared, especially for the large hospitals, health systems, to present multiple times your solution to different
mm,
departments. And in those
right.
presentations, in order to get this trust, building this internal networking in that organization, make sure that you are adjusting the message and you are answering the
Mm-hmm.
questions that those departments are going to have. It's not the same if you are talking to doctors, to IT, to marketing,
Mm,
and so on and so forth, compliance.
right.
That's very important. And then there is a third one that I think that is worked very well for us, which is leveraging channel partners that you may have. Out there, there are big organizations from consultancy to integrators, etc., that have been on the market longer than you, that they have
Mm,
those relationships, networking already established with those organizations. They have their
mm,
trust. So if they see in you, in this case, Mediktor, that you are, offering an interesting value proposition for them, go hand by hand with them. That's very
mm,
important because that's a
wow.
shortcut to be able to piggyback on the trust and the networking built by these organizations. You also mentioned about
Mm,
conventional and unconventional strategies. Uh,
yeah.
we obviously tried everything, especially the first year. I think that we were successful deploying two, let's call it out of the box initiatives. One of them that may sound counterintuitive is that we first focus on trust instead of sales.
Mm,
We knew that we were a company from overseas, we were coming brand new to the States. So if you go after sales, it's very
right.
likely you are not going to be successful. You first have to generate trust around you. And that
Got
was
it.
one of our mantras. And this is where organizations like Note Health, Avia Health help us, along with other
Mm,
initiatives. But that's one that I think that worked pretty well. And the second one is going or following the approach of bottoms up versus top down.
mm,
Usually, company and their professionals tend to follow up the bottoms down, the
yeah.
top down approach
Starting from the top.
nowadays
Yeah.
because it's easy, right? It's
Right.
so easy to find information out there in the internet where the
Right.
market is going, what the
Right.
CTOs are looking for, and based on that, you create the whole strategy. Where
Right.
what we did was the opposite, bottoms up, which was like, okay, we know that we have something that can work, but let's try to truly narrow down what are the needs, what's the value proposition these companies are going to value,
Mm,
this, that hospital, and this is how you
mm,
are able to grow one by one
mm,
when you start. Instead of just attacking all of them with a specific value proposition, do it the opposite way. start conversation with Yale New Haven Health System, Austin Renal Clinic, Albany Med, start, getting feedback from them and build the value proposition and the business upon those conversations. And that's kind of unconventional and work pretty well for us.
Great, great. Yeah, I can imagine these small things keep on adding up over the years, and like gradually
Yep.
the magic happens. Yeah. And I can totally echo with the thought that eventually everybody in health, kind of buys through reference, and which eventually gets built up, with trust and, being there. So first of all, they want to find you, like someone they can trust on. And then, if one does it, then the second one has more confidence that
Exactly.
you are there. You can
They,
get
they, they,
the
they will all
result.
they will always find an
Yeah.
excuse if they don't want to do business with you. But it's true that the more footprint you have, in this case
Right.
in the States, the better to speed up the go to market. But if somebody doesn't want to do business with you, they will always find a reason. Not because you don't have experience in this specific area, in this specific state, etc. But
Mhm.
overall, it's true what you are saying.
Right. Right. Great. No, thank you so much for revising all these sales concepts. So thank you. Moving forward, Vicenc, I would like to know a bit more about, like Medictor's overall strategy, like, especially today, what Medictor is doing and what are some of the plans of the future? What are the changes you are seeing in the market? From where like 5 years back the market was. In fact, you pointed out like it was very different. There was not much motion
Yep.
around these things. But today, I believe it's totally changed. There's a lot more focus on bottom lines. There's a lot more focus on the patient. So, being a player in this market, like how have you seen things evolve and what it means for Medicare?
Yeah, no, absolutely. So, uh, since we started doing business here in the States, we got, I believe, two relevant situations. One of them was COVID-19 that changed the scape for the space for virtual care, virtual triage forever. Before
Right.
COVID-19, telemedicine, virtual triage,
Yeah.
chatbots, etc., was kind of a nice to have. And after
Right.
COVID,
Right.
everybody, I think that
I
we agree that it's a
have.
must have. And on top of that, we got the Gen AI eclosion finally around a year, 2 years ago, that is going towards this direction. It's true that their focus is not yet healthcare, they are focusing on other industries, but that
Mhm.
wave, impact our industry. So that's how the landscape has changed, right?
Mhm.
A lot. So in 5 years, it has nothing to do. And I think that one of the strategies we are following is making sure that, first of all, we chase use cases that truly generate added value to our clients. We discussed the driving business to their facilities. After the acquisition of Sensely, we are going after other use cases that has to do more with conversational AI, deploying avatars you can talk to because for a patient is much easier than just interacting with a chatbot. And at the same time, what we are doing is basically making sure that we are differentiating from our competitors, the existing competitors and those that we expect that are going to start arriving in the market, right? So I think that here we have a clear product and a clear product roadmap that
Mhm.
basically goes around giving preference to the user experience. In our space, the user experience is measured in the number of questions and time spent from the uterance, what the patient
Mhm.
wants and is looking for, till we resolve that
Mhm.
inquiry. So we are on average in 4 questions and 2 minutes. And this is
Nice.
thanks to a unique NLP that we have deployed in-house. that can virtually understand any type of conversation that has to do, even remotely, with signs, symptoms, and conditions. Patients can input the information with their own plain words, as many inputs as they want at once, and this is available in over 18 languages. And we differentiate between dialects, and that's something that is kind of unique. It's not the same British than American, Spanish than Mexican, or Brazilian than Portuguese, right? In healthcare, this matters because
Right.
otherwise the NLP cannot capture the nuances of every language and culture. So that's one thing that I think that help us stand out compared to other competitors. Then
Mhm.
after the eclosion of Gen AI, the fact that we are using white box technology versus black box technology. And for those
Mhm.
that are not familiar with these terms, white box technology means that for every assessment we run, you can trace down the reason why Mediktor came up with this level of triage, this differential diagnosis, etc. While generative AI, they are using black box technology, meaning that not even the developers can tell
Mhm.
why the algorithm came up with that condition, with that triage, etc. Right? And when it comes to healthcare, that truly matters. So we are going to stick to the white box technology so far because we believe that it's what the market is requesting nowadays. And we mentioned the empathy. We recently deployed an avatar you can talk to. This is kind of unique in the market
Mhm.
because people they want to have the feeling that somebody there is listening to them, and the avatar helps in this process of engaging in this conversation. And there are some others, but there is another one I'd like to point out, which is around data, data, and data. It's becoming more and more important. Digital health solutions have shift from provider focus to patient focus and very rapidly to data focus, right? Because they have realized health plans, health systems, etc., that we gather a lot of data. So at an aggregated level, we can share real-time information with these hospitals, health systems, real-time actionable data insights. And that's something that is unique of our solution.
Great, great. I think that's exactly where the market is headed. Like, while uh, doing AI is becoming easier, but, being able to define a unique proposition and an advantage, I think that would really mean a lot in the competitive market. So, great to
Correct.
hear your perspective about, going to market. So one quick thing that I'd like to know is, because we've been talking about all of these different experiences that you've been kind enough to share building Medictor business in the US. So looking back, what are the biggest do's and don'ts when selling to healthcare providers, if you were to summarize it? Now, I would like to know your top do's and top don'ts.
Yeah, so I have a few, but we can pick one for each. When it comes to don'ts, don't ever be the change agent in the organization you are trying to sell to. No matter
Mhm.
if there is a good match of your solution with the needs they have, if they don't have a champion that leads the initiative internally, just stay away and wait to engage with them once they appoint and there is a champion. Because otherwise, you're going to find yourself in endless conversations that lead nowhere. Nowhere. And
Right.
this is a waste
That's a
of
good
time.
one.
And
Good
especially
one.
that applies to large health systems where the champion know what doors they need to knock, what people they need to involve. If you have to find this out, it's gonna take forever and usually leads nowhere. When it
Right.
comes to the do's, I think that involving nurses and getting them
Okay.
excited about the project and making sure that no matter the project you are offering, the solution you are offering to the hospital health system, there is always an angle that has a positive impact on nurses,
Hmm.
that the sooner the better. Because it's
Hmm.
true that the decision maker, the person that writes the check, is going to probably be a doctor or management, but involving nurses, if you get their attention, they are
Hmm.
the blood vessels of the organization. Right? Everything goes through them.
Right,
They are the
74%
and
is
they
the
are the
nursing.
ones that can make something fly or don't fly,
Right.
right? And they are very good actually at convincing nayers because they will you will also find people that don't want to do the project. Nurses is the profile, is the person that is going to be able to turn that no into a yes. So that would be one of the do's that I would like put more effort into because it really pays off.
Great, great. No, solid piece of advice, I think. Thank you so much. So, lastly, and this may be a difficult question, but if you were to pick it, like if you had to start over in the US market, what would you do differently?
That's a tricky question because if you look back, it's kind of easy.
Yeah.
But it's also tricky because there may be things that didn't play out as we thought, but help us in other
Okay. Yeah.
initiatives. But I'm happy to take the question. So obviously, one that we have already discussed is basically putting too much focus on health plans the first year. Now
Mhm.
it's kind of obvious it was not the right thing to do. And there is another one that this is kind of something that I've been thinking lately. I think that something I would change is augmenting our sales and SDR teams
Mhm.
sooner with AI solutions.
Mhm.
It's amazing the solutions you can find out there to generate this profile enrichment, to generate these hyper personalized messages
Mhm.
and it truly help us to be more efficient, right? To the sales, SDR, revenue team, etc. So that's something that I think that we should have invested more on that sooner. They have not been
Mhm.
around like for so many years, but maybe 2 years ago we could have started. And it's amazing how they can help us, do a better
Right.
job overall. So that's a food for thought on my end.
Great, great. Thank you so much, Vicenc. This has been so lovely talking to you. And like I said, really appreciate the
Likewise.
way you have opened your heart to share all these lessons. Because I think, for all the listeners listening to this podcast, they'll find great merit in these wisdom that you have shared today. And truly appreciate for being a guest today on Health Tech with Purpose. We wish you all the best. And lastly, what is the best channel to reach out to you? Is it LinkedIn, email, Twitter? What is the most active? And if you'd like to leave that link for the people.
Shoot a message, an email. LinkedIn is also good. So I'll get back to you. No worries about that. May take some
Thank
time, but I tend to answer all the inbounds I receive. It's been a pleasure. Ayush, thank you so much for inviting us. We really enjoy it. Personally, I liked it a lot, this conversation, and I hope it can help, other companies out there that are in the same situation.
Thank you so much.